Hello, friends. Let's learn about primary versus secondary headache today. Okay, what are these and why are these important? If you know this, your 99% of evaluation of headache is finished. Okay, 95% of evaluation of headache depends on only these factors. First of all, what is primary headache? These are the disorders. Okay, these are the disorders in themselves, and there is no underlying structural or systemic causes, and they are benign and recurrent. Okay, if there is no underlying structural or systemic causes which are benign and recurrent, these are primary headache. Okay, what are the types of primary headache? Most common type is tension type headache. Okay, tension type headache, but these are mostly featureless and bilateral pressure or tight wine like. Okay, and these are mostly mild to moderate, and there is no nausea. While in migraine headache, these are unilateral, pulsating, 4 to 72 hours. They last for 40 to 72 hours, and there can be aura. Okay, these are like photophobia and nausea. While there is something called cluster headache. Cluster headache is severe unilateral orbital or temporal, and there is tearing or nasal congestion associated with this. Okay, this is one of the peculiar thing about cluster headache, and these occur in cluster. After that, let's learn about secondary headache. These symptoms, the headache of secondary headache, have some underlying structure, structural or systemic disease. Okay, and this can be life threatening. What are the common causes of secondary headache? Like there can be vascular causes like subarachnoid hemorrhage, intracranial bleed, temporal arteritis, okay, venous thrombosis, venous thrombosis. There can be infectious causes like meningitis, encephalitis, brain abscess. There can be structural causes which causing pressure, okay, like brain tumor, hydrocephalus, pseudotumor cerebri. Okay, there can be some metabolic or toxic causes like CO poisoning, hypoxia, decreased oxygen. Okay, and systemic causes anything that is associated with fever, infection, sometimes anemia. Okay, these might also cause headache. Okay, there's something called medication overuse headache. Medication overuse headache, which usually occurs due to analgesic overuse, caffeine overuse. Okay, and so one of the main important thing is in primary headache it's idiopathic. Okay, there is no underlying cause, while secondary headache is they must have some neurological finding or red flag we call it. Okay, so let's learn about red flag for secondary headache. Red flag for secondary headache. If you know this, if you know this, then 100% of your evaluation of headache is completed. Okay, this comes with mnemonic SNOP 10. Okay, what is SNOP? SNOOP. SNOP. As per systemic symptom like fever, weight loss, if these are present, it is suggestive of infection or some malignancy. And for neurological deficit, if these neurological deficit is present, then some mass lesion or stroke is there. Okay, O for onset. It is a sudden onset, like it's called thunderclap. Thunderclap headache, it denotes subarachnoid hemorrhage. If it's present in older age, more than 50 years, okay, then it can be temporal arthritis or mass. P for pattern changes or progressive. If it's like migraine headache, sometimes it's tension type headache, sometimes it's cluster like headache, or if the pattern change is progressive, then it's indicative of there is something inside your brain. It can be tumor, okay. There can be due to positional change. There is change in ICP, okay, ICP, intracranial pressure change, and this can lead to headache. Okay, A for snoop, A for additional, okay, additional causes like positional, precipitated by valsalva. If there is papilledema, if it's present in pregnancy, these are all red flag sign, and it indicates there is something in your brain, and you have to rule out the neurological. So there must be some neurological signs, symptoms, or there might be something inside your brain, or there might be some systemic disease which causing headache. Thank you. This much for today.